Good morning, everyone. My name is Terry Allan. I'm the Health Commissioner here at the Cuyahoga County Board of Health, and I'm joined today by County Executive Armond Budish, as well as our Medical Director, Dr. Heidi Gullett. So first, I'd like to welcome County Executive Budish to the podium.
Good morning. I know that Terry Allan and Dr. Heidi Gullett have been offering you regular briefings on the spread of the coronavirus throughout Cuyahoga County. I'm pleased to be joining Terry on Friday mornings to provide you all with regular updates on the county's response to COVID-19. There is a lot, and it's moving quickly. If Terry and I need to increase our joint briefings, we'll certainly do that. First of all, I want to say how very grateful I am to the County Board of Health and to Terry and to Dr. Gullett for their incredible leadership in this very difficult time. They're working hard and they're doing really wonderful work. This is an unprecedented situation, but it's also one that boards of health understand and are experienced and are set up to deal with. Terry and Dr. Gullett they're really the best, and I would say probably the best in the country, so we're in good hands here in Cuyahoga County. Regarding the general county administration, the most important thing I want to convey is that we are very, very focused on both maintaining critical services that we really need to continue to deliver and keeping people in the county safe. That's our number one top priority. As a county government, we're always responsible for very vulnerable populations. The children in our foster care system, children we need to take into custody, the elderly, the homeless, and our jail inmates, just to name a few. And the vulnerable in our community are increasing. What we're seeing is that many, many, many more are now in very vulnerable positions. All the workers who have seen their jobs disappear, their employment closed down, as examples. Just this week, the state has seen more than 111,000 unemployment claims put in, as opposed to somewhere around 6,500, which is more typical. So we're looking for ways to help. Just yesterday, I announced that we're suspending all sheriff sales and tax foreclosures of homes. And for people who are on tax delinquency payment plans, we will not put you in default just due to late or missing payments. The bottom line is that during this crisis, we will not throw people out of their homes. And we'll continue to look for ways to support our residents who are in need. Regarding plans for the people under our care, we announced a full-scale plan for the jail. This is extremely important. The people coming into our jails, the inmates, already have many underlying conditions that make them particularly susceptible to COVID-19. We must keep them safe, and we must keep our staff there safe. The jail is of utmost importance. With hundreds of inmates and staff packed together in close conditions, the coronavirus presents a tremendous risk. I'm excited to say that thanks to the sheriff, Prosecutor O'Malley, Administrative Judge Sheehan, Administrative Judge Early, all of the city and county judges and prosecutors, and the defense bar, we've been able to reduce the population in the jail a lot. Yesterday, we were down to 1,331 inmates. That's the lowest ever in the history of the county, and well below the capacity of 1,865. This is important for two reasons. First, this reduces the risks of people spreading the virus within the jail. And second, it makes it possible for us to create spaces in the jail so that we can immediately isolate up to 25 symptomatic inmates and quarantine up to 48 COVID-19 positive inmates. And we can increase this number by another 100 immediately if needed. And Metro Health has been great. They've developed new jail screening procedures and medical processes to address the COVID crisis in the jail. In fact, the Metro team is conducting increased medical screenings for COVID-19 symptoms immediately upon the entrance of anyone to the jail. Now to our kids. The county's responsible for child protection, and we're not letting this crucial responsibility go. We're still taking calls to the kids' hotline. Child protection specialists are still working cases, making visits, investigating allegations, and working to make sure our children are safe. They're following state guidelines for visits that must still take place, but being mindful of not exposing families and workers if at all possible. And we have many critical services for our seniors. Our Department of Senior Adult Services is continuing face-to-face interactions for emergency adult protective services within 24 hours per the state's mandate. Our centralized intake staff also remain on duty from Monday through Friday, 8:30 to 4:30. Many senior centers have transitioned from congregate meals and are now switching to delivery of meals to our seniors at home. So we're not leaving our most vulnerable at risk. People experiencing homelessness have unique needs to address. There too, we have a plan in place that I'll announce today. We're committed to providing shelter access to persons and families who have no place to stay. During these challenging times, we're attempting to adjust our services to reduce person-to-person contact and encourage self-containment. We'll continue to use the Coordinated Intake and Assessment System, which operates now solely by phone, at 216-674-6700. Coordinated intake is available from 8 a.m. to 8 p.m. by phone, Monday through Friday, and through United Way's First Call for Help during all other evening and weekend hours. That's at the 211 number. We'll begin using a screening process for persons seeking shelter. For those clients who may need further medical evaluation, we're working with Metro Health and Care Alliance, medical staffs there, to assist with further assessments. We want to try to avoid having people with the coronavirus, with their symptoms, from entering a shelter. Another goal we have to reduce concentration of currently homeless individuals in close proximity, which is what happens in the two large shelters that we have typically. A lower concentration of residents in the two shelters will reduce possible transmission. The current single adult populations in the main shelters are 190 women at the Norma Herr Women's Shelter and 400 men at the 2100 Lakeside Men's Shelter. For shelter residents, we will first encourage residents to seek temporary housing with family and friends, and we'll provide incentives to facilitate this, and that provision has worked in the past when we've tried it. And second, we're identifying other temporary housing options in the community in alternative housing sites. Using that approach, we anticipate that we'll be able to reduce the population in the shelters by a minimum of 100 and perhaps more. For shelter residents who test positive, we will place residents in similar housing options suitable for residents who need isolation or quarantine. Now, these are extraordinary, extraordinary times. We're all working tirelessly to address this ever-evolving crisis. I can tell you personally, I've been working almost entirely on the coronavirus issues every day, including Saturdays, Sundays, and all. I wish I had more days in the week. I want the people of Cuyahoga County to know that I and our entire staff are constantly looking at ways that we can protect the safety and security of our community. When the people of this county experience hardship and fear, we don't give up. We find solutions. We're doing that every day. Working together, we can and we will pull through. Thank you very much. I'll be happy to take questions afterwards.
Thank you, Executive Budish. I wanted to thank Armond for his incredible leadership and support and decisive action to protect those that are often marginalized, invisible, or ignored in society, and also the incredible capacity, experience, and intellect of his leadership team and all the social service departments that are working these problems, trying to find ways to reduce exposures and help those that may potentially be left behind. I think it's remarkable. I also would like to thank Executive Budish for his support with the Emergency Operations Center. Even as we work here with our staff round the clock, tirelessly, it is good for the soul to watch what people in the Cuyahoga County Health Department are doing in response, in coordination with Armond staff at the Emergency Operations Center, assuring that messaging, working closely with the City of Cleveland and this Joint Operations Center, assuring that messaging is clear to the public across a range of sectors, addressing concerns from the public, coordinating donations that may be made available so that they get to the places that they need to go. A whole range and countless other good deeds, selfless deeds are happening every day in this community, and it's bringing out the best, I think, in all of us, and I think I appreciate very much Armond's leadership in working through that, including the great support of Heather, who's here providing guidance for hearing impaired, is also another service that Executive Budish is offering to us, and we're grateful. So we want to start off by talking about the coronavirus hotline. With the assistance again of United Way 211, first call for help, we announced this week the arrival of the new line for COVID-19 information. Within the first day of being live, the helpline received 470 calls. We're grateful to United Way, first call for help, and to Augie Napoli, their leader, for his willingness and the agency's willingness to jump in and participate and collaborate. United Way has been this way for first call for help on every emergency I've been involved with in my many years in public health. To reach the Cuyahoga County Coronavirus Helpline, please call 855-711-3035. For businesses, the statement from Governor DeWine recently about taking temperatures of employees each day was a recommendation for businesses across the state of Ohio. It may be best to check your temperature before you come to work so that you don't expose your coworkers in case you're sick. These new recommendations are being worked by businesses and other agencies across the state of Ohio. The goal here is to try to reduce the opportunity for people that may be ill from coming in to the workplace. It's again asking people to be part of the solution. People are working through the recommendations to find the best way to implement these in their work environments, and we appreciate that. Thermometers may be hard to find, and the governor acknowledged that yesterday. It may be something that everyone can do in the short term in terms of looking for opportunities to find thermometers, but also to screen for general symptoms. If you're home and you're sick, please don't come in. Stay home, be part of the solution. Practical social and physical distancing whenever possible. This 6-foot distance is important to think about. We're trying to be conscious of how close we are together in that very regard, so that you have to start practicing what we're asking everyone else to do. Remote work is strongly encouraged. This is an effective way to reduce transmission of not only COVID-19, but also flu. For our food operators, today we're issuing a guidance document to all of our local food operators. Our goal is to provide them with information about COVID-19 and best prepare them for the changes that they have seen in their businesses. Topics include social distancing, hygiene, and personal protection, reminders about employee illness policies, and resources for more information about COVID-19. Please know that the many thousands of restaurants that we have in this community are inspected on a regular basis by our public health, environmental public health sanitarians. We have relationships with the community. We're there to assure that the food is prepared safely and to support them, so this guidance document is designed to help to support them in doing their jobs, since they're part of that critical infrastructure, and we have a lot of respect for that. Please remember that local food operators are still available to find you a variety of options depending on the location. Patronize your restaurants. Stop by on the way home and pick up something, or have something delivered for you. and they're taking steps to assure that they're reducing exposures, but help out our restaurants. They're part of the community and they're part of the critical infrastructure. They could use your support during this time. So please contact your favorite food locations this weekend. I wanted to discuss a rumor that's emerged about the National Guard. We know the governor announced that he signed a proclamation on Wednesday that will activate approximately 300 personnel for the Ohio National Guard to support humanitarian efforts. Humanitarian efforts. Starting next week on Monday, you will begin to see National Guard as they support the Ohio Department of Job and Family Services, the Association of Food Banks, and the Association of Food Banks at locations across the state. As you can imagine, the volunteer system that often supports local food banks has been affected by the current pandemic. Just yesterday, we heard about the lines of folks through a drive-through support network being provided by the local food bank. An incredible outpouring of support. People offering to donate, people offering to volunteer to serve those most vulnerable that County Executive Budish just described. So the National Guard will assist with staffing and distribution of food for those in need. And on behalf of the Board of Health, I would like to thank the men and women of the Ohio National Guard for their efforts and their dedication in this humanitarian effort. We want to also share a warning that was extended from the Ohio Attorney General about scams, and we've been warning you as we hear them. And so make sure that the public is aware that these are happening to protect themselves. The Attorney General issued a warning yesterday regarding scams that include door-to-door salespeople offering COVID-19 testing. There will not be any door-to-door knocking of people offering COVID-19 testing. That is a scam. Asking for any combination of your Social Security number, bank account number, or medical information to qualify for a test. That would never be requested, and there would never be door-to-door testing. Emails that are phishing for information by getting you to click on a link or a pop-up advertisement. Products for sale that will cure the coronavirus. There are none available at this time. To avoid falling victim to a scam, check out any charity organization that you're not familiar with to make sure that they are valid and legitimate before you donate. Don't respond to emails from people you don't know. Don't click on links that are strange to you. Never give out a personal information to anyone. Offer to call the person back at a number that you can verify as being the bank or the organization that you claim to represent. Work with trusted individuals that you've validated. Again, we're going back to the public health tried and true hygiene tips that I hope all of you are reciting in your sleep these days. And it's important to know that these are based on the evidence. These are not just what our grandmother and our mother have told us. These are based on evidence of what reduces viral load on surfaces and reduces risk for transmission. Covering our coughs and our sneezes in the bend of our elbow or with a tissue. Please be sure that your tissues end up in the trash can. For those emptying the trash cans, please be sure to wear gloves or wash your hands immediately afterwards. Clean commonly touched surfaces on a regular basis. Don't share food, drink, knives, forks, or spoons, or cups. We in public health and healthcare can't do this alone. We're all on the same team and share responsibility in this community to flatten the curve. Maintain your social distancing, 6 feet or more apart. And stay home if you're sick. Lastly, I'd ask you to please take a moment to think about a few things today as you personally do your part in this response. Remember all the people we're trying to protect, particularly seniors and other at-risk individuals. Help them to stay at home by providing them a helping hand for groceries, for medication, other things that they need. For those working from home, remember the critical infrastructure folks, the people Executive Budish described through social service agencies at the jail and a range of other services that are working to support our community. Hospitals, grocery stores, restaurants, telecommunications, public health, safety forces, and countless others who are working hard every day to support all of us. Remember those that are having trouble working through child care arrangements to try to make sure that their kids are cared for so that they are able to work. Do what we can to help them and support them. And most of all, remember all those that are anxious and afraid and those that are becoming ill. If we're able-bodied and healthy, we owe a debt to society to be part of the solution and extend that helping hand. So with that, I'd like to hand over the podium to Dr. Gullett. Dr. Gullett is a remarkable person. She is a preventive medicine doctor, and I believe things happen for a reason. She's been with us for a number of years, probably 7 or 8 years now as time goes by. But what we're seeing now, and what I've always known, is Dr. Gullett's ability to extend not only that heartfelt sense of the issues in the community and the people she cares for, but her tactical capacity in working with our team, our incredible team of preventive medicine residents, our staff in the disease investigation units, and all the other physicians that have come and together, and Dr. Gullett has orchestrated them. I thank her from the bottom of my heart and all of them and all of you for what you do. Dr. Gullett, please take the floor.
So I'd like to thank all of our media partners who are here today. You are a critical part of getting to the bottom of this epidemic here in our community, and so I thank you for allowing us the opportunity to continue to brief you with trusted information and make sure that we can get the necessary information to every single person in our community. So thank you for your leadership in the media at this time. Before I give you our updated numbers for this morning, I want to again remind you that everyone included in the aggregate numbers I'm about to provide you is a critically important person in our community. These are people first who have been affected by this infection in a way that's deeper than the way most of us have. Most of us have been inconvenienced in ways we couldn't have imagined a few weeks ago. But some people in our community are actually fighting this infection, and their family and friends are scared because they've also been exposed. And those folks deserve our privacy, respect, and our support in this time. So I would just ask and beg of you to please keep that in mind when we talk about cases. Remember the humanity first. We have had multiple reports this week of discrimination against people who have this infection and their family members and their friends who are in quarantine because they've been exposed. These are business owners in our community. These are people in our community who are critically important members of our community. Any discrimination related to this infection has to stop. It is unacceptable, and it cannot continue. This is when we come together as a community to fight something like this, something we've never seen before. And we in the greater Cleveland are the kind of people who fight for one another, and we rise to the occasion. But we do know that discrimination is happening, and I'm here to tell you today, please stop. We cannot have that. Okay, these are people, and their families are affected, and we need to rise to the occasion and really support them and get them through this. Our numbers today are in aggregate case numbers, and this is Cuyahoga County exclusive of the city of Cleveland, 43 cases. Our age range is 14 to 91. The date of illness onset, February 29th to March 15th. The number of current hospitalizations is constantly changing, and as we get more infections, it's very difficult for us to parse out which infections, which people who are having infections are hospitalized are from which jurisdiction. Because as you know, our hospitals serve a region. And so many of the hospitalizations that are in Cuyahoga County actually are not necessarily Cuyahoga County residents. And so this number I will give you is constantly changing, and I just want people to understand that. We currently have 4 cases of hospitalization in our jurisdiction cases, but you will hear other hospitals talk about more hospitalizations, and I want the public to understand why those numbers may differ. There are 0 deaths in Cuyahoga County to date related to COVID-19 or the coronavirus. If you have been diagnosed with coronavirus or COVID-19, you will receive a call from one of our team members here at the Cuyahoga County Board of Health if you live in our jurisdiction, or you will receive a call from one of my colleagues at the health department where you live. We are all physicians or other public health professionals who are here to help you. We are not here to invade your privacy. We are not here to tell you to do certain things or not do certain things that aren't in your best interest. So we want you to trust us. We know that's hard. You don't know us and we're over the phone. But please know we're calling you to protect you and give you the right information that you need to stay safe and come out healthy on the other side of this infection. Our job is to give you that information and also to provide you with a contact number so that should you have any needs while you're in isolation at home, we can help you get those needs met. Our line is a physician-staffed line, so you will get a physician 24/7, and that number is not public. That number is for people who are affected by this infection, who are either in isolation because they've been diagnosed, or in quarantine because they've been in contact. But I want the public to know we have this infrastructure set up because we care about making sure your needs are met. This is unprecedented to have people in isolation and in quarantine, and we're committed to making sure you have what you need during that time. We also need to identify contacts that you may have had. So we're going to ask you questions which might be a little bit different than you're used to hearing over the phone, such as who have you seen or what stores have you been to? We're asking those to help protect you and your family and your friends and the public. We are still doing what I talked about at several press briefings earlier this week, which is called contact tracing. That is a chance for us to make sure that we're limiting the ability for this infection to spread from person to person. But we have to get information in order to do that. So we just want you to know why we're calling, and we want you to understand that we're protecting your information, we're keeping it private, and we're only using it to get to the people we know are at highest risk for this infection. I would also like to clarify for the public that coronavirus and COVID-19 are essentially the same infection. Sometimes people have been told that they have coronavirus, and other times people have been told they have COVID-19. And in our calling of patients who've been affected by this, some people don't realize that's the same thing. COVID means coronavirus, C-O, corona, V-I, virus, D, disease. So COVID-19 is the year it was identified. COVID-19 is the disease caused by coronavirus. If a health professional tells you you have either one of those things, it's the same thing, it's what we're talking about, and that's why we're calling you. This is different than the virus known as influenza. That is a separate virus that we often call the flu. That virus is circulating widely in our community right now. We have, at this flu season, 28 deaths associated with influenza, and just this week, we have had 5 deaths of members of our community related to influenza. So I want folks to know that this is also an issue that continues to circulate, and I have also been talking about that, but I want the public to understand that they're 2 different infections so that we can best help you and understand why, if you have influenza, we are still telling you to stay home, but you may not be receiving specific information about isolating yourself in the way that you do if you have a positive COVID-19 infection. I also would like to revisit testing briefly. I continue to update you on our regular press briefings about the strategy for testing as a community. We currently are continuing to test the most vulnerable hospitalized patients. That is so that our frontline healthcare teams can protect themselves and that they can care for these patients in the best way possible. We don't have a treatment right now for this, but we do know that these patients sometimes need aggressive respiratory support. So allowing us to test those people is really important to make sure we're providing them the right treatment in the hospital, but also allowing us as public health professionals to make sure we can isolate folks, especially if they're still in the community, and get a hold of their contacts so that those folks know that they may be at risk. So testing needs to be preserved for these groups of people. I know that's frustrating. I know that people have coughs in the community and they want to know, do I have this infection? Please stay home and isolate yourself at this time unless you have severe symptoms and need emergency medical care. And in that case, then we'll preserve the testing for those very serious symptoms. The other reason that we test is to understand the degree of what we call community spread. A week and a half ago, you heard us talk about the first cases related to members of our community who had traveled abroad or to other parts of the United States. But we now know that the cases here are not just related to being in contact with someone who traveled. They're related to what we call community spread, which is we can't trace them back to travel. So in that case, it's important for us to test so we understand how much of this is prevalent in our community. But we don't have testing capacity for widespread testing in the community right now. So that may come at some point, but I want folks to understand that right now that has to be focused on hospitalized patients. We're not ignoring the degree of community spread, but we have to prioritize with the resources we have right now. Finally, I want to reiterate, if we give you a public health message through a press briefing or via the phone, please heed our recommendation. Please do not go out if we ask you to stay home, whether in isolation because you have symptoms or whether in quarantine because you've been exposed. If you don't need to go out, except for getting essential items, you can work from home, please do that. Please do not have parties. Please do not do things that you are seeing on the TV right now of young people gathering together. You are at risk. You are at risk. So we want you to be thoughtful about this. We don't want you to live in fear. We still want you socially connected. But in the era of this pandemic, we now have a lot of electronic devices that allow us to be connected. Use FaceTime. Use some other video means if you want to see someone's face, which I would encourage. We need social connection right now. But please don't gather together in groups. That's really important. So continue to please listen to the messages we're sending. You heard the messages about good hand washing. You've heard the messages about social distancing. We will continue to remind you of those, but please also listen to us about having gatherings in places right now. Please don't do that. Last thing, this is very stressful for all of us, but we cannot beat this if we're immobilized by fear. If we are not able to work through this together as a community because we're having fear, we are not going to be able to provide and protect for the most vulnerable in our community. So I would ask people to take a deep breath. Think about self-care. Think about your own mental health. Talk to someone if you need it. There is no shame in that. There is no stigma in that. We are all in this together. And I would specifically ask you very practically today to think about one thing, just one positive thing you can think about in your own life that has happened because of this. There has to be at least one for all of us. And for me, one of them is that I've heard from family members I haven't talked to in a very long time who reached out to say, I care about you. I really want you to be safe. Thank you for doing what you're doing in some cases, but really it's, I care about you. And I've been able to reciprocate that. And to me, that is a huge blessing and a positive part of all of this. So I would encourage everyone today to think, what is that thing for you? That helps us to not so much dwell in the negative, but to think about, this may transform our lives, it may be frustrating, it might really have upended everything for us. Many of us can't figure out how to homeschool our kids. We have no idea. I'm not a homeschool educator. I have no idea how to homeschool my kids. But you know what? I'm going to figure it out, right? I can't dwell on the frustration in that. I have to stay positive, and all of us do. So please think of that one thing today. And I would just ask that you please, please, please lead with love and gratitude in this difficult time. We'll go ahead and take some questions.
Before we start with questions, there's a few things that have emerged as we've been talking. The idea that Dr. Gullett described around people gathering together, it isn't just about you, right? It's about seniors and at-risk people that you could unknowingly expose. So remember, I think I said a day or two ago that Senator Sherrod Brown said his daughter told him, we shouldn't act like we're worried about someone else that has COVID-19 and they giving it to us. We should act as if we have COVID-19 and we don't want to give it to anyone else. I think that's the way to think about this, so we are all part of that solution to the problem. People in lines in businesses around this community, the business owners working closely with the patrons need to recognize, again, they have a responsibility to spread out in line if they're going to be in lines. Do what you can to spread out, to reduce distance, to expand distance between people, to reduce that risk. That's critically important. The guidelines we put out for food operators today speak to guidance for them within the food service environment to reduce the amount of time where there may be that contact may be occurring to reduce risk. We need to all be part of that process. At this time, we continue to work with restaurants, and they're learning about what the guidance is. So we are stopping out and giving friendly reminders to restaurants. They're operating. All restaurants that are licensed to operate continue to operate according to the rules. But right now, they've been learning about ways that they need to comply, and we're educating them, and they've been cooperative. So I want you to know that that's happening right now, and we'll continue to fulfill that responsibility going forward. With that, the county executive and Dr. Gullett and I can take questions.
Are you guys aware of any walkouts by county employees over concerns about safety, including possibly fleet employees?
I'm sorry, including
Fleet employees? Apparently on the Harvard maintenance facility.
I'm not aware of any employee that's not come in that's been asked to come in. Okay, the question was, am I aware of county employees that are not coming in, I assume due to fear of the coronavirus? We're certainly recognizing that there's a lot of our employees that are at risk doing their jobs. That's why we started by putting out an order that any employee that doesn't have to come into their job, if they can work from home, they work from home. If they don't have to come in and they can't work from home, they should still stay home. Those were the orders we put out. We worked with council, county council, to add 80 additional days so that if people do get sick or have a need, it's not even limited to the coronavirus. They can take 80 additional hours of time. We don't want people coming into work if they're sick. We don't want people contacting the community if they're sick. But some people have to keep working. We have corrections officers in the jail. They can't work from home. They have to keep working. We have some of our people who work in children and family services that have to go out and investigate allegations of abuse. We can't have them working from home or not working at all. So the answer to your question is I'm not aware of people who have walked out or stopped coming in, but we've certainly heard from people that they're concerned about their health, and we're concerned about their health, and we're evaluating every day. Every day at the county we have a morning phone call, usually goes at least an hour. We talk about the concerns that people have presented to us, and we try to deal with them.
In regard to reducing the population of our jails, how exactly did you go about deciding which people would be released, and is there a certain next tier of people who would be released if you decide that you need to reduce the population even further?
The question was, how did we go about reducing the numbers in the jail? Again, I have to say that, first of all, it wasn't me that reduced it. It was a combination of people, all of those who are critical to this process. I give a lot of kudos to Administrative Judges Sheehan in the County Common Pleas Court and Early in the Municipal Court. County Prosecutor O'Malley has been fabulous, as have the city prosecutors. The defense bar has been wonderful. The sheriff's department has been cooperative and wonderful. And so we're down from what was hovering around 2,000 for many months. We're down to 1,300, which is just hard to comprehend. 1,300 people now in the jail. They've been focusing on people who don't need to be there in the judge's view and in the prosecutor's view. So they look at low-level offenses. They look at people who are not violent. And they're also considering, I believe, some of the risk factors to the coronavirus. So people who might be very old or susceptible are getting some additional consideration, I believe. But they're making sure they're not going to put the community at risk. That is absolute. They are making sure that people who are violent offenders, who are sex offenders, they are not getting out. It's the low-level offenders that they're looking at.
You had talked about the homeless shelter and some changes that you're considering out there. I'm wondering, you talked about screening efforts. Have those started already? Are they beginning today? And how are you able to, I guess, keep folks apart in there? These efforts haven't started yet, right? You guys are just getting going, is that correct?
That's correct. I believe they'll start either today. Mary Louise, do you know when they start? Oh, sorry, I have to repeat the question. When are we starting these new processes at the homeless shelters? And the answer is, I believe it'll be today or Monday. And those include having Metro Health and Alliance coming out, and Metro Health and Care Alliance? Care Alliance coming out and doing screenings. They'll do the basic screenings that we do at the jail and we do other places. And if somebody looks like they have symptoms, they'll be sent to get further testing. If If necessary, we will be able to isolate and quarantine, and we've had ongoing discussions where we've identified where people would go. We're going to reduce the population in the shelters regardless by somewhere around 100, maybe a little bit more, by moving people out. And that process, I think, will help protect people in the shelters and in the general community.
Good morning. My name is Melissa Surratt, Mr. Budish, if I may add to it.
Yes,
I'm
please.
with the Office of Homeless Services.
Come on up, come on up. It's great to have staff that is knowledgeable and not shy.
Not at all.
Thank you very much.
Good morning, everyone. Again, my name is Melissa Surratt. I'm with the Office of Homeless Services.
Wait, we can't see behind the monitor. Just step over a little bit. Come on.
I need to grow is what you're saying.
Sorry.
My name is Melissa Surratt. I'm with the Office of Homeless Services. We are currently working with Care Alliance and Metro Health to hopefully begin screening by the beginning of the week. However, since all of this has came about, we have had a hard press to work with individuals to strongly encourage those currently in shelter, if they have family or friends that they can reside with, that is the safest and best option at this time. So the shelter system has individuals currently move on in transition, and in the meantime, we're working to ensure that they understand whatever housing plan that they have developed and is in place will not be disturbed during this time, and then we're working on additional alternative housing options to hopefully continue to reduce the amount of individuals that are in the shelter. While I'm up here, if I might,
Please.
I'd like to truly thank the direct service workers in the Cleveland community that are serving those experiencing homelessness. They continue their mission, they continue their service at this time, and their flexibility and their creativity and willingness to be committed is unwavering.
Can
So
you
thank
repeat
you.
your name for
If
me?
I can just add to that, because it goes back to your question as well. We have people who are putting their health at risk every day. People who are working in the shelters, people who are working in the jails, people who are deputies who are in touch with people. There's children and family service people that go into people's homes to check and make sure kids are safe. I mean, every day we have people. We have even the folks that are just working in our administration building. People are coming in to do some business that they have to do, and yes, their health is at risk, and these people understand that, and I can't say enough for how selfless they've been, and recognizing the needs of this community do come first. So I really appreciate it. I want to second the statement.
Yes, Chief, your name for
Melissa Surratt.
And your exact position, please.
I am Assistant Program Director of the Office of Homeless Services.
Thank you.
Spell your last name.
SIRAK. Thank you.
Thank you.
State numbers are about 119 cases statewide. Of those, 53, possibly even 56 now in Cuyahoga County and Cleveland. Why are we such a big chunk of these?
Thank you for your patience as we try to practice social distancing and awkwardly pass each other at the podium. So the question is, why are there so many more cases in the Northeast Ohio region, Cuyahoga and Cleveland specifically, as compared with the rest of the state, when you look at our state numbers that are publicly reported as of this morning? And that is partly because we have had the most testing capacity of anywhere in the state. So our hospital partners really stepped up to the plate and very quickly coordinated with a business that works with the CDC to get the right reagents and supplies to do testing here. And so in the state of Ohio, the first few hospitals to go up and running with in-house testing were here in our community. The two hospitals that we've been talking about, University Hospitals and Cleveland Clinic, and now Metro Health, very quickly came on board with testing. Therefore, we were able to test far more people in our community initially than anywhere else in the state. And so when you have increased testing capacity, you will find increased cases. But that doesn't necessarily mean there aren't other cases in a similar prevalence in other parts of the state. Again, just reminding folks, even though we have more testing capacity here, it is still not sufficient for a community testing strategy. So we're really trying to make sure that we're thoughtful about this, but that is one of the main reasons that you see more tests here positive.
Are there any rough estimates how many cases could be in this area, just undiagnosed?
That's a tough call. We are being very careful and very conservative here around how we identify cases. So my team, our team, is working really carefully with anyone who could have been exposed and who has developed symptoms to give them isolation recommendations and then to also follow their contacts even though they may not have lab confirmation of the infection. So I cannot give you numbers because that is something that's very difficult to do, but we do know there's a lot of symptomatology or symptoms happening in people, and so we're treating them as if they probably have this. But again, remember, influenza is also really common right now. This is a late and significant level of influenza in our community. And this particular influenza is happening also in people who had the vaccine. So we know that that's also an issue for us, but that does not mean that we don't feel vaccines are great. So please remember next season to get your annual flu vaccine. That's still really important, but we do know we've had a spike in influenza late, and so that's also part of some of the symptoms people are having right now.
We're going to take one more question, please.
Dr. I was curious about discrimination.
Go, we'll take two because you haven't had a chance. We want to get the right information out, so.
I was curious, you brought up we've seen cases of discrimination. I don't know what that means. What's happening to folks and what shouldn't people be doing to others?
Thank you for that. The question is, I brought up discrimination earlier, and the question is, what does that mean? Can we explain that for the public? And yes, thank you for asking me to clarify that. I would be happy to. Again, privacy is of the utmost importance to me, so I will not be giving you identifying information, but I can speak to generalities about what we've been told this week. So we have been in contact with many people who have these infections. We contact every single person who's positive in their list of contacts. So we've been on the phone with hundreds of people in our community. And we know that people who have this infection have been told to not come back to work. Their family members who are business owners have been on social media. People have put things out, don't go to this particular place because this person is related to somebody who has this infection. We have received reports of people from certain backgrounds, racially and ethnically, who have been treated poorly not because they have the infection, but because somebody is inappropriately connecting this virus with a particular group of people, which is totally unacceptable. So those are the kind of things we're getting. I don't want to give you any more specifics because I don't want to release anyone's privacy, but please know that these are the things that we're seeing. So please be kind. Please be kind to everyone. If you're in a drive-through, be patient. Do not cut someone off. If you're on the highway, don't cut someone off. These things have happened to me in the last couple days, and it's frustrating. Just be kind. But if you know someone's affected by this virus, be extra kind to them. Okay, don't do anything on social media around, putting them down or their family down or their family business. Those are the kind of things I'm asking for the public to really do. We'll take the last question.
I saved a tough one for last. This is for the county executive.
Excellent. I will get out of the way.
I thought that was the last question.
Yeah, exactly.
19 is investigating a murder suspect who may have been part of the release program. I don't know if you're familiar with any such people, and regardless, what assurances can you give people that all of these offenders are nonviolent?
I'm not aware of the case you're referring to, so I won't be able to discuss it. Even if I could, I couldn't, but I don't know it. In terms of the question, how can we be sure that the people who are being released from jail are not violent, I can answer that in a couple ways. First, I know what the judges and the prosecutor are doing. They're being very careful. I can't tell you that there's a 100% success rate, but I believe that they are so careful that there shouldn't be violent criminals being released. We all agree those people should stay in jail. We certainly have the capacity to keep them in jail. If you look at what's happened in other cities and states that have programs for bail reform, for early release programs, etc., there have been great success stories and very few, not 100%, but very few situations where somebody gets released under one of those programs and then goes and does something terrible. Very few situations, to my knowledge, nationally. So bail reform has been something that I think the community generally agrees is something that should happen. What's been happening over the last few weeks has been effectively bail reform, or looking at justice reform to make sure that people who don't need to be in jail don't have to be in jail. But it's those kind of questions that have, in some ways, inhibited the release over time of prisoners that really should not be there. Low-level drug offenses, for example. But people are afraid, if I let somebody out of jail, what if they do something bad? Then it's my fault and I get blamed and I don't get reelected. So, that's exactly the reason why I believe it hasn't happened more in the past. But we're seeing it happen now.
But you're confident that Judge Sheehan and Prosecutor O'Malley have done their best to vet these people, and that the general population is safe?
I can assure you that Judge Sheehan and Prosecutor O'Malley have done absolutely the best job they possibly can to make sure that the community remains safe.
Okay, we're done. Thank you very much. Appreciate your time. Thank you.